and Dr. Tanya, Dr. Amarnath is a graphologist and forensic expert.
Yes,
He's
I have seen his video that you have shared in the group today. And अमरनाथ सर, मुझे बड़ा अच्छा लग रहा है आज आपसे कनेक्ट होके। और अवधेश सर उसका मीडियम बने हैं। आई एम वेरी हैप्पी टू कनेक्ट विद यू एंड टू
Thank you,
कनेक्ट
ma'am.
विद यू
Thank you.
ऑल टुडे। लाइक
I also
बेसिकली
shared
सर,
my
बेसिकली
profile.
हाँ हाँ,
I shared my profile also
या आई हैव सीन इट, आई हैव सीन इट इन द ग्रुप।
for
एंड
future webinar or conference we can do in the field of graphology and handwriting, graphology, fingerprints.
so currently I'm working as a counseling psychologist in Lucknow, Uttar Pradesh. And
Okay, very good.
I am I am a certified parenting coach, life skills coach, and a certified career counselor as well. इंटरनेशनली या नेशनल लेवल पर मैं अभी इस समय साइकोलॉजिकल इश्यूज को और मेंटल हेल्थ को लेकर काफी काम कर रही हूँ, और बहुत सारे प्लेटफॉर्म से वर्चुअली भी जुड़ी हुई हूँ और वैसे भी थोड़ा सा एक्टिव काम कर रही हूँ।
Yeah,
और
very good.
रिसेंटली मैंने डॉक्टर रामन लोहिया नेशनल लॉ यूनिवर्सिटी में एज एन असिस्टेंट प्रोफेसर ज्वाइन किया था, तो मैंने वहाँ पे भी अपनी सर्विसेज दी हैं। वहाँ मैं फॉरेंसिक साइकोलॉजी पढ़ाती थी, तो ये सारी चीजें बड़ी इंटरेस्टिंग लगती हैं मुझे। और
नहीं, बहुत अच्छा.
उसके बाद मैंने जेलर्स को पढ़ाया। उत्तर प्रदेश प्रिजन हेडक्वार्टर है अपने संपूर्णानंद जेल कारागार,
जी
वहां
जी.
पे मैंने जेलर्स को पढ़ाया। और इस समय मैं उत्तर प्रदेश सुरक्षा मुख्यालय में हूँ, और वहां पे मैं आईपीएस ऑफिसर्स और जो सिक्योरिटी गार्ड्स की जो ट्रेनिंग और रिफ्रेशर कोर्सेज चलते हैं उसमें मैं जा
जी.
रही हूँ, और बाकी अपना क्लिनिक रन कर रही हूँ। ये
नहीं, बहुत
छोटा
बढ़िया.
सा तो है, लेकिन आपके जैसे लोग सच में बहुत इंस्पिरेशन का काम करते हैं, बहुत इंस्पिरेशन का काम करते हैं हमारे लिए।
नहीं, आप बहुत
और
अच्छा कर रहे हैं, बहुत अच्छा.
नहीं सर, आप लोगों के से मतलब मैं बोलूंगी ना, आप लोगों से सीखने का बहुत मोटिवेशन होता है, बहुत अच्छा लगता है। और अभी मैंने रिसेंटली एक बुक भी लिखी थी फॉरेंसिक साइकोलॉजी पे, थियोरी रिसर्च एंड प्रैक्टिस, तो वो पब्लिश हुई है अभी।
वेरी गुड.
अभी भी मैं सीख रही
कॉन्ग्रेचुलेशन.
हूँ, और मैं चाहती हूँ कि आप लोगों से कांटेक्ट में रहूं, ताकि कभी कुछ पूछना है या किसी तरह का कोई गाइडेंस चाहिए तो आप लोग नहीं है हमेशा। सर आपकी आवाज नहीं आ रही है, आई थिंक आप म्यूट हैं।
नहीं नहीं, बहुत बढ़िया. तो which publisher you use for writing your book?
सर प्रोग्रेसिव पब्लिकेशंस, इंटरनेशनल पब्लिकेशन हाउस।
Very good.
थैंक यू सो मच सर, थैंक यू।
because in our group nobody is knowing what graphologist is. They think that graphologist is a pseudoscience. So I will be pleased if you will introduce graphologist or
No, I can't hear you. Yeah,
Okay, Tanya.
I can't hear you. Everyone can hear me? Am I audible?
Yes, you are.
Yes, yes,
Okay,
you are
okay,
audible.
fine, fine. Should we begin?
Yes.
Okay.
Yes, please.
Good evening, everyone, and a very warm welcome to all our esteemed participants joining us today for this unique and insightful webinar on graphology, decoding handwriting in medical practice. I am Dr. Tanya Dikshit, a counseling psychologist, a certified life skills coach, parenting coach, and internationally certified career counselor. I was a former assistant professor in Dr. Ramanohloya National Law University as well. Apart from that, here we have with us Dr. Awadesh Kumar, MD, Associate Professor, Department of Community Medicine from Autonomous State Medical College, Ayodhya. And I will be your host for today's session. It's truly a pleasure to have such a wonderful, distinguished gathering of medical professionals, educators, and curious minds here with us. So, we are joining today by doctors from diverse specialties psychiatry, neurology, pediatrics, and general medicine, each bringing a unique lens to the fascinating intersection of handwriting analysis and behavioral science. Your presence reflects a growing interest in holistic diagnostic tools and the subtle cues that handwriting can reveal that talk about cognition, personality, and even neurological health. Graphology, often misunderstood as a pseudoscience, is gaining renewed attention in clinical and psychological contexts. Today, we'll explore its relevance in medical diagnostics, patient profiling, and therapeutic communication. Whether you are a skeptic or a supporter, we invite you to engage with an open mind and a scientific curiosity. It's now my honor to introduce our keynote speaker, Dr. Amarnath Mishra, Associate Professor, MIT University, India, a renowned graphologist, handwriting analyst with over 14 years of experience in behavioral profiling, handwriting interpretation, and a renowned forensic expert in his own field. He has worked extensively with background of forensic professionals to bridge the gap between handwriting traits and clinical observation. We are thrilled to have him guide us through his intriguing journey today. Over to you, sir.
Thank you, Dr. Tanya, and thank you, Dr. Awadesh, for inviting me, for giving a brief note on graphology. What is graphology and what is the importance of graphology in personality assessment as well as in criminal tendency identification? So, already we know that handwriting is the brain writing. So, that is governed by brain. So, handwriting is a brain writing. So, Dr. Avdesh told me just give the brief for 5 to 10 minutes yesterday. So, thing is that I also published one paper on forensic graphology. So, many times, just like astrologers, I found card readers and also numerologists and also graphologists. So, they are telling on the basis of handwriting. Many times when you are writing any essay or you are writing anything on the plain page, so on the basis of your writing on upwards and downwards, we also know the uh, s- the mental status or thinking process. So, madam is also from psychology. So, psychology generally we are able to say about on the basis of their behavior, their tendencies, their eating habit, their process of eating. choosing of the things, talking habit, precise on some topics, or discussing, so we can know the mental status. And as a human beings, we have some experience. We are also old, and we met with many peoples, and we are also meeting with many peoples on daily basis. So we know the personality, that how that person deal. That person is good, that person is cunning, that person is very soft-hearted, that person is aggressive. So what happened? I'm audible? Properly, I'm audible? Okay.
Yes, sir, you are completely audible. Please continue.
Okay. So what happened? Just like graphology, psychology. So on the psychology, on the basis of questionnaire, on the basis of the analysis, we ask a few questions. Here, what happened in graphology, when we are going to study. So nature and signature we are unable to change. That is take proper time to develop. So same, that is the handwriting. Signature is also handwriting, but that is in the short and minimum size. So what happened? Handwriting, where we can write more things, where words, alphabets, and also there is different year. So suppose some students have writing in class 5 and now in 10th. So there is variation in handwriting on the basis of the growth, on the basis of their environmental condition, their practice of writing. So also somebody is writing alphabets in their own way, sometimes more pressure. Sometimes there is not cursive writing, there is lifting, pen lifting is more. Sometimes there is very good writing, just like printed. So these things tell about the personality of writer. So if somebody is like red color pen, somebody is writing precise, means very pressure on the page, and there is other side we can easily know that handwriting is precise. So we know the intention, aggression of that person. And if there is a writing is to and fro, not proper systematically. Okay, so means that person is not proper understand the process, or there is no proper goal. And sometimes there is a pain lifting, means that person uh, can change their planning, their prospect, if somebody is giving some information or guidance. So what happen in such type of condition? We require to know on the basis of the practice the personality of a person. So in civil cases, we can tell about the personality of person, and for the solution purpose, we can also guide that you have such type of things, and you can improve yourself in this section, so you can do better. Same thing in psychology. If there is a counseling, what happen if somebody is worried, or some pressure, some tension, so we also giving the proper solution, proper guidance. So think that such practices required by that person who are dealing with that handwriting or that personality trait. So that is depends on the personality. When we are going for the forensic graphology, before that, I want to say writing is brain writing. Handwriting is the brain writing. So many times people say about pseudo writing. That is pseudoscience. Sorry, pseudoscience. So that is science is not pseudo. And if there is control by the brain, so that is science. Okay, and neuroscience is one specialization, psychology is one specialization, and graphology is very highly specialized, and very few expert in India. So many using only for the personality assessment. We can also use it as a evidence also. So that can help because in interview, in interrogation, police personnel investigating officer ask many things. So many times on the basis of handwriting, we say the tendency of suicide or homicide or any other issues. So thing is that we can also guide on the basis of analysis about the paper. Like Professor Dr. Avdesh is a community medicine professor, so there is preventive and social medicine. Also, there is a preventive and social forensic, where we required precaution. Precaution is better than cure. So when we can identify the threat, so we can resolve on the basis of study of graphology, study of psychic or psycho analysis, psychometry about that person. So that can help in reducing the crime rate and also good lifestyle of the person. Because many, all person are stressed, having a um, ambitious in nature, and due to ambitious and due to taking loans, they also having some financial crisis, and not only financial, also in personal life there are many issues, in health issues, health also there is a major issues. So proper lifestyle is very important. So for that, graphology, psychology, and other things also required for the good lifestyle. Forensic graphology, when we are saying about forensic graphology, there are many cases where suicide note, like Burari mass death case, there is Narengiri Mahant death case, there was suicide notes. So that suicide note saying about the mentality of that person before going to suicide. So that is also psychological autopsy. Psychological autopsy is not only based on the psychometry and other things, also things which is available at the crime scene in the form of any note, any handwriting, or recent any things which can help about the mental tendency of that person, that is the psychological autopsy. So graphology, psychology, such type of things required to betterment of civilian life, as well also solve the cases which is related to court. So this is helpful in interrogation, just like in lie detection, brain fingerprinting. We can also utilize graphology. We can also utilize the psychometry. So such type of things very important. And I like interest of Dr. Awadesh in this field, and I already told him that we can also write graphology for the purpose of different institute, which is helpful for uh, deeper knowledge by the person who are in this
Yes,
field.
yes, sir. We
So
are
very good approach. I will also share my paper which published in near 2018 or 17 in this chat. Okay. And already I have shared my profile. You can contact me. I'm also practicing as a forensic expert under Section 39 of Bharatiya Sakshya Adhiniyam, and also teaching as a professor in Amity University, Noida. So you can call me anytime or mail me for any guidance or any help. Thank you so much.
sir. Will you please elaborate about a psychiatric illness, depression, mania, schizophrenia, can graphology?
Uh, your question, Dr. Avdesh, like anemia. Okay.
Yes,
So anemia or any lack of things in the body. So if a person is not happy, if a person is ill, so such type things is also we can find. in her or his writing. Because if somebody is writing with a good mood, okay, so what happens? There is a very beautiful writing. Somebody tell that, sir, my writing is always going to change. So that is based on your mentality. Because sometimes you are happy, you are talking much. Sometimes you are unhappy, or some issue with your boss. So you are talking in another manner. So same when we can go for the further study that we link graphology with such type of deficiency, we can go for the questionnaire and also examination of that person who writes some given paragraph, and also we go for the blood test, so we can
Actually, they
correlate that.
macro writing and micro writing is related to psychiatry. In micro writing, actually, schizophrenic patient write in small writing. That is micro writing. And a person who is very happy, very can do it feeling write in a very big and large letter. So, is there any relation between that?
Actually, micro and macro writing is definitely, because somebody that is depends on the mindset. When a person in situation where not happy, not feeling good, so there is a chances of micro writing. I think micro means in a small way. Yes, Dr. Avdesh. And in macro writing, if writing in the proper manner, okay. So this is also happen many times. If we are go for healthy subject, they are also writing in different manner. Because if I'm teaching in masters, so my students having different writing. Somebody is very nice, somebody very small. So I tell them that you don't have some dream. Okay. So thing is that is depends on writing. We can go for some pilot study in these fields. Okay, so we
Yes,
can
sir. Yes,
also get the accurate data.
yes, sir. We are preparing for that. Okay. Thank you, sir, for your great knowledge. And we have questions from our participants. Do we have any query from participants? Or would you like to ask anything about graphology from Dr. Amarnath or from me? We will please to have sight on that. You can unmute yourself to ask questions. We have left only 4 minutes, so please be fast. After 4 minutes, the webinar will be over. Hello, can you hear me? Dr. Tanya?
Yes, 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 you are audible. You are audible.
So, if there is a query among participants, they can ask, or we should proceed with graphology. Dr. Tanya, would
Yes,
you like
doctor.
to ask?
Yes, doctor. This you reply, or I required to reply?
Both can.
What is the
It is,
biggest mistake people make while reading handwriting? Okay,
yes, sir.
so generally people, what is the percentage of accuracy of handwriting analysis? Okay, so in prospect of forensic science, okay, when we are going to say law of comparison, so we can match the handwriting. And when we go for the law of individualities, so just like fingerprints, if somebody is write something, okay, so there is a chances that their both writing is not going to be same. Okay, there is a natural variation of the same person after some time interval or in two setup. Okay, so natural variation is there, and on the basis of the writing style, on the basis of the formation of the alphabets, we can identify. And when people reading handwriting of any person, so that is their prospect. If that person is forensic psychologist or psychologist, or somebody is graphologist, so they will understand on that basis as per the requirement of the question. But normal people just read the uh, handwriting as per their, for the purpose of information. Okay.
Yes, sir. We are
Uh,
hearing.
I will share one paper on forensic graphology, and always there is a keen observation, and there are two or three setting is required to understand the proper writing for the purpose of graphologist. Okay, and that report is helpful. Okay, Dr. Awadesh is also messaging you in chat box. Okay.
Yes, sir. Yes. I am trying to give answers as far as my knowledge is.
No, no, you all are welcome. You can discuss anytime. I can come in your college or institute if required any lectures.
Yes, sir. We are planning for that. We will surely invite on some occasion.
Okay. So thank you. Very nice field of graphology, and we required to work in this field.
Yes.
So we can find more observation, and we can link with many things that will also helpful in the form of publication.
Yes, sir.
Okay, then. Thank you very much.
Thanks to you, sir. Thanks to you for the wonderful information that you have shared with us today. And first and foremost, I extend our heartfelt gratitude to our distinguished guest speaker, Dr. Amarnath Mishra, for sharing such rich insights into the science and subtleties